you to do in advance of the meetings. All right, rolling right along. Let's see, Salma is on virtually. We're ready for a financial report.
Yes, I am. I'm going to go ahead and share my screen. Can you hear me okay?
Yeah, loud and
Awesome.
clear.
Perfect.
Thank you to our IT folks.
Well, good evening, everyone. Today, I will be presenting the year-to-date financial statements as of September. So our total revenues, and starting with our revenues, they are currently ahead of the budget by 12%. This is primarily due to some of the new grants that we received this year that were not part of the budget. And also charges for services are ahead by 12%. And this is because we've already surpassed our medical billing budget, which includes Medicaid, client fees, and insurance fees. The other side of the charges for services also that we've surpassed is restaurant licensing fees, which is currently at 105% of the annual budget. Moving to our expenditures and starting with salaries, they are a little bit below budget, and that is because we did contract some of these positions that were part of the annual budget and their salaries and benefits, but we contracted those, and therefore those are now reported under other charges for services. We did surpass some of the other line items also, such as supplies, direct assistant, because of those additional revenues that we received. Since those grants were not part of the budget, the expenditures were not part of the budget as well. Intergovernmental charges are being reported at 86% of the annual budget, and that is also tied to our restaurant licensing revenues. So these would be the state portion that we issue, the state part of the license. And then interdepartmental, so far the county allocated 72% of cost allocation charges to us. When it comes to our county transfer, we've utilized 60% of our county transfer to date. And again, that is because of the surplus from the revenues over expenditures. I do want to highlight, or I'm not sure if I mentioned that during previous reporting cycles, that one of those awards that we received, the new awards, is a revenue replacement award that allowed us to shift some of the existing expenditures to the grant. Therefore, that created some savings in our budget. However, we are intending to fully utilize those savings to fund any year-end projects. That's all what I have for this month, unless if you have any questions.
Board, any questions for Salma?
Move to approve the financial report.
Second that.
Motion and a second. Any discussion? All those in favor, please say aye.
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 Report approved. Thank you, Salma.
Thank you.
All right, Mary, we're up for the on-site wastewater case presentation.
Good evening, everybody. My name is Mary Sloan. I'm with the Environmental Health Division, and we are going to discuss the variance case 24-111-726. So this is for property 23424 Shady Lane. We have our applicant here, Alex. He bought the property back in September of 2023. It's a 0.141 acre lot. It is served by Idledale Water and Sanitation. However, Idledale Water is just a water district. It does not provide sanitation. It is a mountain residential 1 with zoning, and they are requesting a variance from the setback from the soil treatment area to the water line main from 25 feet to 12 feet. So the current system is a concrete tank with a non-conforming seepage pit. We have limited details regarding this system because it was discovered through a use permit inspection. That's a very limited inspection. It happens at the time of sale. But it was marked as non-conforming, so therefore it failed the use permit inspection, which requires an application to be submitted to our department for an OW replacement. The proposed system that the engineer has provided is a TL2N system. It's a Jefferson singular tank with a 500-gallon pump tank and a 376 square foot soil treatment area that would include a 30 mil liner and a 3-foot sand filter. So this is located, the property is located right off Highway 74, right along the creek there. This is a really old subdivision, really small lots, as I'll demonstrate in a later slide. But just to kind of give you an idea of where it's located in Jefferson County. So this site definitely has its limitations. They had to obtain a floodplain permit from Jefferson County Planning and Zoning that was obtained using treatment level 2N as their proposed design. And then they also had to get an easement to the property to the south. So you typically have a 10-foot setback requirement with the property line in your septic components. They had to reduce that and they got an easement to the south, also show. They won't be on the property line, but they'll be about 5 or 6 feet from the property line when the requirement is 10 feet. And that will just be for their soil treatment area. Not all components will encroach on that. So this is kind of demonstrate the entire area is in.
I'm gonna take her while I'm listening to Board of Health.
What?
Can the attendees make sure you're muted, please? Go ahead, Mary.
All right, so this is a cut sheet of the engineering that was submitted to us. So this is a demonstration of the floodplain along with the components. So as you'll see right here, you have a rock wall, this solid black line, and then you have your soil treatment area, your pump tank, and then the Jefferson tank, which would achieve higher level treatment. So you're very tied in there. And then you're 50 feet from the creek, which is the requirement per the regs. And then here's the same thing, but without so much layering. So as you'll see, the dotted line is your water line main. So that's from Idledale Water. That's 12 feet to your proposed soil treatment area. And then as you'll see down here to the south, that is not going to meet that 10-foot requirement. So we're going to be a little bit closer. But the engineer has butted up as close as they can to that rock wall to achieve the greatest distance that it can from the water line. This is essentially the area that is going to be installed. So as you can see, it's not, a very structured rock wall, but they're going to install the components as close as they can against there. No blasting has been proposed. They think that they can just excavate as is, but then you're gonna have, this wall right here. You're gonna have this wall right here, your tank come out of that, and then your soil treatment area in this flatter area. And then of course the roadway is right here. So you're working within a very limited space. All right, and then I'm gonna kind of just zoom in. It's a lot of. So to your north, only a 0.35 acre lot. We really don't have a lot of records of installation for these properties. So all I have to go off of is use permit. And as I said before, use permit inspections are very limited. They go out there, they pump the tank, they guess the gallons, and they try to guess the components of either the seepage pit or the soil treatment area. So this is very rough, but the property to the north is about similar size, and it's a treatment level 1 system with a seepage pit, probably the same composition as the 21434 Shady Lane, the property in question. And then back behind, you have a vacant 10 acres. And then this property right here, in which they're going to share the easement agreement with, that's a 0.22 acre lot with 2 bedrooms. No records of installation, treatment level 1 system with the soil treatment area. Now, our department actually permitted the, two neighbors down, a higher level treatment. So similar to the proposal you're considering today, it's a treatment level 2N system with the seepage pit. And the water line was not located when this was installed, so we don't know the exact setback for this seepage pit and the water line main, because as you saw in the engineering, the water line runs straight down Shady Lane. So we're not sure on that setback. Same thing, further to the south, treatment level 1 systems with the soil treatment area. You know, limited, we have one of the records and then another use permit inspection. So how accurate is the use permit inspection? I mean, it depends. Hopefully it's very accurate. But as you can see, all the properties are very, very small, 0.31, 0.35, so not very large lots. All right, so our approval conditions, you know, they would have to stick to the variance agreement. They would not be able to increase the bedroom count, capacity of the system, anything like that. They would not be able to reduce any setbacks without board approval, and they would have to follow the recommendations of the engineering. Now, as the case manager, I would recommend that if you do grant this variance, that treatment level 3N is installed. At the time of the application, treatment level 3N was not an option. They just approved through state a new tank that would allow the same amount of footprint and that would reduce treatment level 3N. So it's still a Narenco product. It's just now being made into a poly tank, which keeps you in your square footage that you need available. But it was made previously in a concrete tank, which would not fit on the property. So as the board with just stipulation that based on the regs, a repair, would you consider this request to reduce the setback from the water main from 25 feet based on the requirements of the regs to 12 feet? That's all I got.
Any questions from the board for Mary? Do the applicant want to share thoughts? Do we need to swear in? Is this a testimony?
Yes.
Welcome. How's it going? Can you share your name and address?
Yeah, it's Alex McKenzie-Low, 21434 Shady Lane, Idledale.
And Alex, can you raise your right hand and swear that all their testimony will be the truth before us?
I do.
All right, please, you have the floor.
Yeah, so basically when I bought this property a year ago, they said the septic wasn't up to code, so that it would have to be replaced. So we got multiple quotes and bids on it. We found that it was gonna be right at like $41,000. Since then, you know, it's gone up with more treatment, and so now it's at like 50-some thousand dollars. So I'm already in like pretty serious financial distress, being a single guy trying to pay my mortgage on my own and do all this stuff. So yeah, I don't know that I'm gonna be able to afford living there if I have to spend hundreds of dollars every month pumping out a vault system, which is what I was told my alternative is. And I obviously didn't know any of this until I was already moved in, signed the form saying I do it within 3 months. And we've just had to keep extending it just because this property is so hard to work with. There's literally nowhere else it can go. So been trying to do everything I can. I paid for a survey to make sure we know exactly where the line is. Been following up with Idledale Water to work with them, see if we can come up with a solution. So trying to be proactive as I can. I just don't know what else to do at this point.
Any questions for Alex on the board?
So I do have a question, which is, excuse me, whether Idledale Water has been cooperative with you and responsive to you?
No, I've left them multiple voicemails, called repeatedly. I have no idea where they're at with it.
All right.
And have you considered this potential change to a 3N TL3N system over the 2N that you've proposed?
My engineer Annette said it would raise the cost substantially, so yeah, she says that it's not necessary, given where we're at, she can comment more on that. But yeah, again, I'm already stretched past where I thought I was gonna be as far as paying for the septic system, so going up to the 3N treatments is just gonna be a nightmare. Not exactly sure how I'm gonna pay for it.
Mary, do you have any estimates on what that is, or is the engineer available?
The engineer is online,
Okay.
so I'll let her speak to that. And then, just for clarification, Jefferson, like our department has reached out quite a few times to Idledale Water and has not received any decision. They were supposed to have a hearing on the 26th of September to, decide whether or not they would approve or deny or have any proposals, but no feedback.
And that was approving, what were they approving?
Well, I suggested encasement based on our regulations and they didn't support that or deny it. They also didn't support or deny him replacing his system. So just no decisions were made.
Is the engineer available? We hear.
Yes, I'm here. Can you hear me?
Yeah,
Hi, my name is Annette Martin with 5280 Septic. As far as cost of a treatment level 3N, I'm not sure what the exact cost difference would be between what I designed versus the treatment level 3N. I do know if I were to take a stab, it's probably about $7,000 to $8,000 more than what we have designed. Mr. Mackenzie Lowe has money in escrow, but it's not going to be enough to cover what a 3N system would cost. And I really, from an engineering standpoint, I don't see what the benefit of a 3N system is in this circumstance. The only reason that we have advanced treatment as a treatment level 2N at this point is because it was part of planning and zoning's floodplain requirement to protect the Bear Creek watershed. So planning and zoning approved my design with the treatment level 2N system. Just to protect their watershed. There was nothing asked of me to provide a 3N level system. From regulatory standpoint, I meet all my setbacks for OWTS components. We're more than 50 feet from the creek. I have no other setback issues other than the property line encroachment, which we have an agreement for. So I guess I'm confused as to why what benefit a 3N system would even have in this circumstance.
Just the highest level treatment possible would just be better, considering you're right there at the creek and potential, issues with the water line.
2N treatments are based on a 50% nitrate reduction, and I believe it's a 25 milligrams per liter of TSS and BOD, somewhere in there, as opposed to a TL3N, which is a 10 milligrams per liter of TSS, BOD, and a 70% nitrogen reduction. So it's just added protection to the watershed. And because the creek is close between the water line and the system, it's additional protection to the water. It was our recommendation based on providing the highest level of protection to the water system, which serves hundreds of people.
But would the T2 level be just unacceptable?
No, and that is correct. It is additional protection. And I understand the reasoning for Bear Creek watershed protection is that I think there's to not get too deep in the weeds, there's a total daily maximum load limit being placed or developed for Bear Creek Reservoir that's based on nitrogen and phosphorus loading to the watershed. And so anything that can be taken out of the watershed provides greater protection to Bear Creek and the Bear Creek Reservoir. So I think that's where the floodplain requirement came from in terms of reducing the nutrient loading into that section. But she's right. And on top of it, Annette also added a 3-foot sand filter in there, which will do a lot to remove bacteria and from the effluent. So I think it is very protective in its own right. It's just not as protective as the 3N.
And Mary, I think you had mentioned in our previous discussion, there's a liner being proposed for the creek side of the soil treatment area. Board, any other questions for applicant or the engineer? Sarah, any questions online?
Nope, none for me.
Thank you, appreciate your time.
Thank you.
Hi, I have a couple of questions. My name is Bhushan Supori. And I live very close by there. The 25 feet.
Before you give, so do we have folks, are you wanting to give testimony either in favor or against the variance?
It's public comment.
Just want to check in. Did you want to give testimony on this variance? Are they muted?
No. Where that individual went.
Because we can take comment for and against. We just need to know who's signing up and that they're sworn in.
Okay, try again.
Okay, is it?
Yeah, if you can share your name and address.
Yeah, my name is Bhushan Supori, address 21564 Shady Lane.
And are you,
this?
you want to give testimony for the variance?
No, I don't really have testimony, but I had a couple of questions. Is that okay? Or?
Yeah, we're not really, this isn't a public comment period. We are able to take comments, but as far as a back and forth question, we don't really have a process for that.
Well,
but share, if you have any comments, please share those because they might, even if they're just questions.
Well, okay, so would this presentation be available to me so I can kind of digest that carefully?
Is that something that's available to them?
It's online right now.
That it should be on the web right now. All these documents.
I see, okay. So what is the way, how can I get a copy of that?
Is it on the Jefferson County Public Health website?
Under Board of Health.
Under
And
our
then
Board of Health.
the documents are under the packet.
Okay. Okay. No, so that is good enough so I can kind of digest. Is that 25 feet from the stream or is it 25 feet on the other side? That is a standard distance.
Yeah, so at this time, we're not taking public comment and sort of discussion. This is a little challenging. We can take testimony on the variance, but as far as explaining all of it, that's, I think, what Mary just did in the presentation. So all that information should be in that packet.
Okay, all right, that's good enough. I should be able to.
But we'll hopefully answer some of your questions in our discussion. So.
Okay, thank you.
You bet. Anyone else wishing to give testimony on the variance? Board, any additional questions you need answered? So we're considering, which hopefully answers the gentleman's question. The regulations require 25 feet separation from the soil treatment area to the water line. They're not able to achieve that based on this lot. I don't think it was achieving that for the previous system either, which is failing. So now we are considering granting a variance to that separation based on what they can achieve.
I might have missed this, Mary.
It's okay.
Did you already have an idea or were you able to tell us what the difference in cost is between the two systems?
No, that would be a question for the engineer, because it varies greatly on, you know, what's
Oh,
your
it does.
components and your contractor and
Okay, I think that's what the,
or maybe
Yes,
Alex
that's
has
what I
an
think she
estimate.
wrote.
Yeah, she mentioned $8,000
that's right, that's right. Thank you.
past.
I
what
thought they
have.
said it and I missed it.
Yeah, I think the applicant has really inherited a very challenging situation and has already invested a lot in it. I mean, this is property that if it was today, we wouldn't even have built a house there. It's in a floodplain on a creek, let alone put a septic system in there. So, and the septic system that was in there is kind in calling it a septic system, a seepage pit, basically. So, which it sounds like what many of the neighbors have. So sounds like there are water quality issues in this area and probably will be for quite some time, given the age of the systems here and the age of this water system, which is also challenging. So this is another one of the challenging scenarios we get where we don't have a wonderful option, other than the current option is not one. It's a failing septic system with someone living there. That's not, that can't continue. And so the applicant has been working diligently to figure out what it takes to fix this. So. Anyone prepared to make a motion? If not, I can make a.
I'll make a comment and then a motion.
Yeah,
I mean,
please.
my comment is just that I think we probably do have concerns in that area, given also and the applicant does too, given the lack of cooperation from the water district. Hopefully we could figure out some way to address that outside of this whole process. You know, other than that way, I think, Lane, you summarized it well, that, this is probably the best that can be done with a bad situation. So I will make a motion that we, accept this variance, approve this variance.
And I agree with Harriet. I think that, the Idledale area is, old. Sir, I believe your house was built around 1916. Houses up there are very much on top of each other, and it's a game of Twister sometimes. But I think the key is the system is failing. It hasn't failed. And I think that he's trying to be proactive in fixing that. Is that correct? Is that what I'm hearing?
Yeah, absolutely.
And I think that, per Jim, who I believe, has great expertise, a level 2 with this filtration, being added on that, is much nicer than alternatives of doing nothing.
Right.
And we certainly don't want to put somebody out of their house. I think that, the game of Twister, gets us to the point where a level 2 is better than doing nothing at all, or causing, you know, this gentleman to have to relocate and move elsewhere. That's just kind of how I feel about that. I appreciate your proactivity there, right? So does your neighbors. But I will admit and acknowledge that I think that, we're gonna hear about Idledale for as long as I'm on the board. And I think that, it would be lovely to hear from Idledale Water, and Sanitation at some point, about just future plans and whatnot, so that, you know, we can all kind of understand and have a bit more of a relationship and understanding, so. So I would second Harriet's, motion to approve.
Can I just make one comment?
Yeah, we're gonna actually, so we have motion second.
Oh,
now
that's
it's
right.
Open for
Never mind.
plenty of
Is
discussion.
it okay?
Yeah.
Okay.
Yeah.
You know what? And I completely agree. I just wish somehow we could find a system, because you all worked so hard at trying to get us, that this guy would have known, Alex should have known all of this before he ever bought the property. And I just wish we could somehow brainstorm with all the brains that we have in this room at some point, how do we fix that? Because he probably wouldn't have bought it.
No, it would not have. It's been quite the nightmare.
Well, thank you for being proactive. I appreciate that.
The one thing I'll just say is the department does have a use permit. So that when properties are changing, they need to inspect the system and identify what's there. It may not really share what extent is it gonna take to get it up to snuff and give you a good ballpark cost. That's the hard part. So there's now
That's why we got three.
just a flag saying, hey, there's a problem here, you're gonna have to fix, but no price tag of what that will take.
Should we confirm that nobody from Idledale Water is on the line?
Sure.
Absolutely.
Yeah.
Yeah. I think there was enough.
It's very concerning, actually, but. Okay. I'm done.
Any other discussion? Sarah, anything on your end?
Everybody's already said what I was gonna say. Thank you for being proactive. I agree 100% with Sherry. Would be nice to have more proactivity, but looking forward to voting for what's
Yeah.
next. Thanks.
Well, that is something maybe to think about, Jim, for the team is, are there other proactive things to start identifying some of these so that there is more information about what it's gonna take to fix this when somebody, sells their
Just to
property.
let the board know that, the state is in the process of updating Regulation 43, which is the onsite wastewater regulations, the foundational regulations for the state. Once that's approved, we have 1 year to update our regulations to come into conformance with the states, any changes that they've made. We've been in many areas more stringent than the state for years. But you, as the Board of Health, could add more stringent regulations to the use permitting process or the use permit regulations that perhaps could, I don't know, maybe mandate that there be some investigation of cost or pricing or options for replacement of failing systems or what have you, as a part of that process before approval could be given for it. So we'll consider some options and probably offer things up to you as we move into the review of the regulations. So that if that's something that the board is interested in improving in our own local regulations, we can do so.
All right, we have a motion, and a second, no further discussion. All those in favor of supporting the variance, please say aye.
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 All right, variance approved. Good luck to you. Thank you, Mary. Thank you, staff.
Thank you.
All right, we are ready for new business. Cody. Placement update.
Hello, can you hear me?
Yes.
Perfect. And I'm going to share my screen real quick. All right. Good afternoon, evening. I'm Cody with Infectious Disease Epi, and I am here just to give an update to what we've been doing. It's been a few months since I've spoken to you all. So I want to, there we go. Just a quick update. I want to do a quick little Q3 of 2024 review, talk about the upcoming viral respiratory season, and then give a very quick overview of a Marburg virus disease outbreak in the Republic of Rwanda and what we're doing to prepare for that. So for Q3 of 2024, we don't have finalized numbers yet. We expect those to come from CDPHE probably mid-November. But for now, I wanted to give a little soft highlight to a few of the conditions we've talked about over the past year. So pertussis, we are in the thick of pertussis. Right now, cases are increasing compared to previous years. If you look at this chart here, you can see the rate for cases by month in 2024 and then the previous 5 years. 2024 being that uppermost orange colored line. You can see it is significantly higher than all the other lines. We've talked to the state a few times about this, and they continue to say that while cases are rising and the rise is concerning, it is most likely a return to normal from pre-pandemic cases. The non-pharmaceutical mitigation that we've done for COVID-19, social distancing, mask wearing, really getting people to like understand how respiratory illnesses are transmitted, washing our hands. They all help with COVID-19, they help with flu, they also help with pertussis and keeping cases down. As we slowly move away from those measures, we're going to see rises in everything, and we're seeing a lot of rise in pertussis. One thing to note here is the state says that pertussis rates are similar to like 2018, but they're not exactly the same. Actually, I was curious, and I went and did a very quick chart of this, and while 2018 rates are higher than the other 5 years, 2019 to 2023, they're not often above the 2024 level. So if you kind of look between that 1 and 2 line there, that gray space in there, 2018 kind of follows right along inside that little gray space, above everybody else, but below 2014. We are, as epidemiologists, ready to investigate all cases that are reported to us. We are watching several schools for watch lists and outbreaks if outbreaks are happening, and helping provide the schools with mitigation and things to do to control the spread of pertussis. We also are putting out a local HAN, or a health alert network advisory, going to our local medical providers to remind them that pertussis is around, and answer any questions that they might have about antibiotic therapy, exclusion criteria from work and school, and recommended prophylactic treatment for household contacts. We also wanted to give a little update on Mpox. Mpox had a worldwide outbreak in 2022, which kind of continued into 2023 and 2024. Jefferson County saw no new cases in 2023, but in 2024, we've had kind of a steady case all year long. One reason we did want to highlight this is because currently all cases through 2022 and through 2024 have been clade 2. And clade 1 virus, which is a little bit more severe, has recently been detected outside of the Democratic Republic of Congo. So we are, again, prepared to respond to any cases if we have any. We have not seen any cases outside of, or in the United States, of this clade 1, but it has been seen outside of where we've traditionally always only seen it. And our last one we've talked significantly about is West Nile virus. If you remember back in February when we did a full review of 2023, we highlighted that big purple spike there where cases were 10 times higher than the 5-year median for the previous 5-year median for 2023. This year, as you can see that burnt orange line again, we are back down to what's generally anticipated for Jefferson County. So we were super excited about that. We did a lot of work with EHS and with our health comms to put messaging out about West Nile, and making sure that people are just aware of what's going on, both locally and throughout Colorado. So we were super happy to see that our cases were back to what we anticipate, and we don't expect them or anticipate them to go any higher for the rest of this year. Starting 2 weeks ago was the start of the 2024-2025 viral respiratory season. This is a season where we generally see more influenza, respiratory syncytial virus, and COVID-19. Those are illnesses that we are generally concerned about and watching for. What we're doing at Jefferson County Public Health, our EPIs are doing case investigation and outbreak monitoring for outbreaks in schools, child care centers, long-term care facilities, residential living facilities, correctional facilities, and case investigation in our priority population. We don't have enough time to investigate every single case of influenza, but hospitalized cases in people older than 60 years of age, we do investigate to see if there's a known or an unknown outbreak at like a long-term care facility or something like that, that we can jump in and help provide mitigation guidance and keep one case from becoming many. We also monitoring county and state trends to see how we are doing compared to the rest of the state, and how we are compared to previous years. CDPHE, we're not the only one doing increased surveillance. CDPHE during this time, they do surveillance on hospital usage, how much of our hospital beds are going to influenza cases, RSV cases, COVID cases, versus other things. They monitor mortality data. They do wastewater monitoring to see if we can't identify new variants that are circulating in the water that we haven't detected through tests at our healthcare facilities. And they also report data up to the CDC. And then the CDC also does all their monitoring. They have some really great real-time monitoring, or as close to real-time monitoring as we can get. I like highlight two things here: their flu view and their weekly reports. Flu view is an interactive dashboard that you can go to. On this screen here, it's that corner map that has the United States in green there. It's interactive. You can play with it. You can filter down to different lineage and different types of influenza. You can look at different states and see what's going on in real time. They also give a static report, which is that one just above the map of the United States. This report is lags by 1 week. So what that means is on Fridays they'll publish, but they'll publish the week prior because that week hasn't completed yet. So for instance, this one up here ends October 5th. This is their most recent issue. On Friday, they will give one that goes through the week of the 12th, so last week. So that's what it means by 1 week. And then CDPHE also has the viral respiratory disease dashboard that they will be publishing. Right now, there's not any information in it as they are bringing it to go live on Friday the 18th. But you can also get more local information about flu, RSV, and COVID-19 in the state and in Jefferson County on the CDPHE website. And our last thing we wanted to talk about was just Marburg virus outbreak in Rwanda. So CDC and the World Health Organization have reported an outbreak of Marburg virus in the Republic of Rwanda. This is a rare, but it's a highly fatal viral hemorrhagic fever, kind of like the Ebola virus that we've had a few lessons from in the recent past. Currently, the risk to the United States is low as there is no confirmed cases related to this outbreak reported in the United States or in countries outside of Rwanda. We did get our last update on October 10th. There are about 8 districts that are affected. There's 38 confirmed cases, 19-ish. There's probably more are healthcare workers, but they are no longer reporting out cases by healthcare worker status or not. So we don't know how that number is growing or not. And there are 13 deaths, or there were 13 deaths as of October 10th. We are prepared to work with CDC and CDPHE to do travel monitoring for high-risk workers, high-risk healthcare workers who are coming back from Rwanda. They will be excluded from work for 21 days from their last time in a Rwandan healthcare setting. And we will monitor for fevers and to see if they develop any symptoms of Marburg virus. And if not, then they'll be cleared to return to work. And if so, we have our SOPs that we've put into place. We spent the last year through the Chaos to Clarity project, making sure we had everything ready for this situation. We have all those in place and we are ready to act as needed. There are 6 of us epidemiologists who are ready to support this. And then we can also pull out of our SOPs an ability to surge extra people if we need to. We will get another planned update from CDPHE on this on the 17th. So until then, we don't have much. And hopefully we don't have any like emergency meetings between now and then. We like those scheduled ones and no unplanned ones to give us updates. But that is all that I had as just a quick update of what Infectious Disease Epi has been doing and to kind of give a little bit more detailed information about what's on your placemats this month.
Thanks, Cody. Sure.
I have a question. Thank you, Cody, for that report. Glad to see that things are at least going in the right direction. One of the you talked about was the West Nile came way down. What are the kinds of treatments and how does the department or the health department help bring those down? What are some of the things that you all do?
So treatment-wise, treatment for West Nile is mostly supportive. There's not an approved medication out there that treats West Nile. So most of our cases are either not sick enough to go to the hospital, or they're so sick they're in the hospital that the hospital will treat them for all of the symptoms that they're having and get them through their illness back to health. What we've been doing, like I said, we put out a lot of messaging. Our health comms did a great West Nile campaign in June or July. I don't remember which month it was. For the month, we did our environmental health had mosquito traps that they put out and monitored for mosquitoes that were caught and had the virus in them to allow us kind of see where it's circulating within the county. As far as what we did that actually lowered the case count, we don't have any data to say like what we did actually did this. We didn't measure that. We can't measure that. But we like to think that our messaging that we put out there, our awareness, are reminding people that there are things you can do like wearing DEET. And if you are not a fan of DEET, that you can wear other items that aren't DEET that are effective against repelling mosquitoes. You can do that wearing long sleeves and long pants that are loose fitting during dawn and dusk. Emptying and turning over pots and things that collect standing water on your property so that mosquitoes don't have a place to breed, things like that.
Interesting, thank you.
Cody, do you, and this may not be for you, this might be for the vaccine team, do you have any idea what our kind of vaccination rates are like for pertussis, specifically school-age kids? And then some of the other, flu, COVID, what are our vaccination rates looking like?
So I don't have any of that data on me right now. That is probably a great question for our vaccine team. They might have it on hand a lot faster than I can get it.
Sure.
Yeah, I would love to get you that. I don't have those numbers right in front of me right now, but I'd love to get them for you guys right now.
Cool. And if you wouldn't mind putting the COVID numbers on your placemat, that'd be great too, because I didn't see those.
Yeah, absolutely. Yeah, we can have those in.
Awesome. Any other questions?
I have just one last. I don't know if you are engaged specifically with the our wonderful new van that is out there.
No,
But
I am not with our van. I'm very jealous of everybody who gets to utilize our van while I'm stuck at home. But I know it and aware of it. Yeah.
Well, they do flaunt it, I know, but we all do out in the community. I just didn't know if you were a part of that, so I'm assuming make it an update, maybe?
Yeah, well, we're gonna be talking about immunizations.
Okay,
During
all right.
director's updates.
Cody, thank
Cody
you.
has the very important job of tracking all of the cases and calling them and asking them invasive questions.
Okay.
And then if Cody wants to ride in the van, we will take Cody in the van.
Go Cody.
Yes, ride along. I'm all for a ride along.
You haven't.
He's in.
Yeah.
Your sleeping bags away.
Oh, we got.
Any other questions for Cody? Anyone? Thanks, Cody. Appreciate your update.
No problem. Have a good evening.
Thank you.
All right. Resolution for consideration for the board.
So per your August meeting and discussion, you directed staff to prepare a resolution for your consideration tonight. I believe was shared with you all, and if you have any questions for me, would love to.
Skelly. So board, in our packet, we have a draft resolution looking at Jefferson County ballot initiative 1A. And would like to open it up for discussion from the board.
I got hung up in another meeting, so couldn't go back by my office to get all my stuff, so I'm not, but I'm just looking on.
Thoughts from the board?
I support our resolution. I like it. I think it's well written. I think that it's important for the voters to recognize that these funds could be really well spent on some areas that we've decided our community needs improvement in. And that's included in our CHIP plan. So I feel strongly that we should try to do everything we can to support bringing these services and continuing services at Jefferson County.
Ditto.
Thank you.
Is that a legal term? Ditto?
I concur. Is
Is that legal?
legal?
Yeah, she said it's legal.
Okay.
Well, then ditto.
Yeah, I appreciate that staff were able to draft this for us. I do think it's a really important issue that we need to make sure there's a lot of information out there. And we are able to take positions unlike the staff, so I'm very excited to see this. So Sarah, any thoughts on your end?
I mean, since ditto is now a legal term, I guess ditto, but no, I appreciate the work and the work that was put into this, and especially, yeah, I just think it's great, like you said, that we are able to take positions when staff are not. And I just a lot of gratitude for getting it done so we can actually vote on it today.
And I think it's important for the community to know that public health funding has not been substantial for my entire career. And in fact, we've seen reductions in funding in Jefferson County because of a lot of issues. And this is one measure that can start to address some of those for public health and for other issues within the county, not just public health, but that's our purview. So this is an important piece to help protect some of the funding. And I think honestly, more is needed, even just beyond this. So, but,
The only thing that I would add is that when it's, if this board votes to adopt it, is that the resolution be moved from the executive director's stationery to the Board of Health's stationery.
The other comment that I want to make, very specifically for the public, is the fact that this is very targeted as to what the funds and stuff will be used for. And I know in Jefferson County, that's a really important issue for the voters and for the citizens. So I was really happy to see that it's very targeted. And those areas, we are really going to be in a mess if we don't have the funds for the stuff that's in this proposal on the ballot. So it's very targeted, just like they asked for. So I'm hoping everyone can support it.
I almost feel a sense of urgency with wanting to get this passed, and personally have been speaking with my neighbors about the importance.
Oh, good.
Yes, especially considering the public safety efforts that it supports, which includes our mental health systems and getting people access to help that they need, having that available. Things along those lines. So yeah, I just think it's really important.
Anyone wish to make a motion for this resolution?
I'll make a motion. Motion to approve.
Second.
Motion to approve, a second. Any additional discussion? So the one caveat I'll just add to that is we're going to remove Dr. Story contact info from the header so that it just is Jefferson County Public Health, the Board of Health, and my signature at the bottom so that it's not coming from staff.
Nice catch, Gary. Yeah.
Thank you. Our astute legal team. Good job. Okay, all those in favor, say aye.
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 All right, unanimous support. Thank you.
Thank you.
Thanks, Kelly.
Right, next up, departmental updates, starting
Wonderful.
with Dr. Story.
Thanks. Less me today, more team. I've had a lot of quality time with the board this month, and I just shared the state of the department, so I didn't think it was really necessary. Not much happened in the last week, I'll just say. But if there are questions I can help answer along the way as the director's update, I'm happy to do that. I also have to sneak out if we're still talking in 24 minutes for an event, but I don't know if that'll be the case. I will have a few director updates, not everybody, and then hopefully I got everybody on my list, but maybe we'll start with Kelly if you want to get back up. And Kelly's gonna update us on some comms campaigns work and some recent media releases, and you all should have received the updated media, the like earned media numbers, not just the digital analytics. Alex Bolivar sent the quarterly media updates, which should help with some of the numbers and things you might want to know ahead of the board meeting. So Kelly, the floor is yours again.
I can tell that my slides are working, so I don't have to ask.
Yes, yeah.
So just to real quick recap the numbers with you all for the past quarter. We've had 31 media placements. Alex continues to bust her own record, it seems like, every few months. We're tracking 18 media outlets. We've been quoted, or subject matter experts throughout the department have been quoted 12 times. And we are increasing our percentage of Spanish publications with earned and placed media as well. That is kind of a goal area for us, is to improve and increase how much content we are offering in Spanish as well as in English. Dr. Sherry mentioned we're doing lots of campaigns. The West Nile campaign, I should have added those graphics given some of the updates that we got today, but the ones we've done in the last few months have focused on suicide prevention, where you can see the short video graphic there that's going on the slide, as well as our Voting is Health campaign, which is not in any way encouraging folks how to vote, but is encouraging folks just to participate in voting and mean to participate in decisions that affect their health. And we're tracking the metrics and analytics on all of these campaigns, as well as our kind of day-to-day run-of-the-mill content that we promote as well. Ways for you all, staff and folks watching, to engage in our content is that we share some of the creative with you all as well. So banners for LinkedIn or social media, whatever social media platform you prefer to use. So those are all shared with the board, following our posts on our different social media channels, resharing them and interacting and engaging with them as well. Some of our campaigns do have a connection to certain events. So our Voting is Health campaign is connected to some voting and vaccines events that we're doing in connection with the reporter's office, where we'll have mobile clinic offering some vaccines for a lot of our respiratory illnesses that are circulating and hopefully not circulating this time of year. So folks can kind of get a 2-for-1, cast their vote, or learn more about voting, as well as get vaccinated while they're there. And then we're tracking the data and the metrics on all of our communications as well, and sharing and reports out with you all, as well as with staff. So if you're curious about what the impact being had by this campaign approach, as well as our regular approaches, you'll see those reports as well in your Jeffco emails. We're all over the place. We are on Facebook, we're on Instagram, we're also on X, we are exploring on Twitter, LinkedIn, as well as our website updates as well. So check this out if you haven't already. Any questions? I'll cede the floor.
Oh,
Thanks, Kelly.
Thanks, Kelly.
I will just add that you have in front of you an example of a new type of material we created for the voting campaign. It's a door hanger, English and Spanish, so take and just slip on a door. I also want to add, and a big round of applause for the health equity team, who is working on reestablishing kind of what their mission is and what their role is in the organization. And they're really shifting to a community organizing model. And their first little mini project is distribution of door hangers in places where people are least likely to vote and least likely to have their voices heard. So they will be door knocking and talking to regular people and introducing themselves as representatives of the health department. And we're really excited about that new way of just getting straight to people in a really strategic way. So excited to see, we'll report back on that maybe at our next board meeting. We also have big plans for Thanksgiving related to that, which just came up today, that involve meat thermometers. So I'm very excited about that. Max. Give us something good, Max.
I'll give you a mix.
Okay.
First, about the numbers, I will absolutely get you our vaccine numbers, knowing that they will be changing pretty rapidly over the next couple of months since we are in our busiest season right now. But I will get you.
Yeah, even last year's would be good.
Absolutely, some year over year view. And with the van, I just picked it up from Tune Up today and dropped it off right before I came over here. That will be out on Thursday, actually, at the Larimer Coin Laundry voting registration event as a part of the Voting South. Again, I'm telling anybody how to vote, but to get out and vote, have their voices heard. So we're doing vaccines and voting registration in conjunction. Some media partners will be out there with us as well to inform them about the importance of vaccinations. So that is from 10 to 1, I believe, and it's COVID vaccine.
And where is it?
Yeah, where's Larimer Coin Laundry?
I can give you the address.
Don't worry, I'll look it
Yeah.
up while you're doing
Thank
that.
you. I'm sorry, Lamar, not Larimer.
Oh, okay.
I said
I thought we were all the way to. That is 666
It's on
7 West Colfax, Lakewood. It is right next to Casa Bonita. It's in the same shopping center.
So they have a few of them. Yeah.
Okay. Is that the one?
That is the one. And
I
then we
see.
have another one at Westland Coin Laundry later that day as well. And that's 1545 Quail Street in Lakewood. So exact similar event, which is a great aspect of being able to have the vaccine van. You can just pick up, go and launch another event right down the road wherever we need to be. So very excited about that and how many miles we've been putting on it. Today, didn't use the van because it was getting its tune up, but the nurses have been out doing great stuff. Got the open spaces crew, about 50, a little over 50 of them vaccinated today in a couple hours. So they're doing great work. Speaking of COVID vaccines, just kind of wanted to give an update on where we're at. Working, as Salma already touched on, a lot of revenue capture. How are we reinvesting that into providing vaccines for people in the community that need them most? A big place where before we kind of restructured our billing practices, where we leaned heavily into was our 317 program. That was a part of the Bridge Access Program through the CDC. Congress gives Department of Health and Human Services money for vaccines for uninsured and underinsured folks. That trickles down through the Bridge Access Program at CDC and then to the state, and then the state parses that out to the people that need it most. We have relied very heavily on that for our underinsured and uninsured folks. DHHS had to cut about $4.5 billion from their budget. So we knew there would be a shortfall of funding a little bit. We were going to be a little bit tighter with what we needed. They asked us to use conservative numbers. So we asked for the conservative number of 150 vaccines to be able to give freely. We will be receiving 10. So 10.
Oh.
And the shipments have been delayed for those as well. So hopefully those came today, should be coming sometime this week, but pretty underwhelming amount. So we're figuring out how to reutilize some of that captured revenue, maybe shift county purchase, talk with the Board of County Commissioners as well, to just allow us to transfer over and pay for some of those ourselves. But knowing Cody had touched on the importance of these vaccines during respiratory illness season, obviously took a little bit of wind out of our sails, but the team is pivoting very well. We have also started working, thank you to Lindsay and her team, with Benefits in Action, so that anybody that comes into the clinic that we can get signed up for Medicaid. We have somebody there that's a representative to help them get signed up and families signed up as well. So actively working on how to make up that shortfall from the DHHS funding, but just wanted to give you a heads up in case people are upset they're not getting those free vaccines. We're working on it. We have plans, we're enacting them, but it does change how we pivot and meet the needs of the community.
And who made the decision to give us 10 versus 150?
CDPHE, because their funding was cut from the CDC and their funding was cut from Congress. So fun stuff. Any questions about that? All right, thank you. And thank you for all of your continued support and for shouting out about the van whenever you can. We'd love to have you guys come by and check it out sometime in action. please let me know, and I'll let you know when the closest outreach event is to your availability. So, thanks.
Thanks, Max. Love it. I'm gonna go get my vaccines tomorrow at the laundromat. Maybe I'll bring my laundry as well.
I was thinking of that. I just got my COVID and I'm getting my flu vaccine this week. But King Soopers as a partner, and there might be others, they're actually giving people money, store credit if you get your vaccine. So that might be
Interesting.
another thing to do is look at all the partners, since you're not gonna have the ability to have a lot of vaccines, maybe let's find out other partners who are doing incentive kind of programs to get people, you know, because hopefully there's others beyond just King Soopers pharmacies, but I'm aware that they are.
Absolutely.
So, because I was gonna just do it at my work, and then they were like, well, we'll give you money. I was like, you're gonna give me money to get a vaccine. I'll do it with you. Fine.
That's amazing. Lindsay? Would you send out the details of the voting and vaccines events to the board so that they have the addresses and times?
That'd be great.
And yeah, because me looking it up here might not have been the most appropriate or accurate thing, so. Let's see who else we have. I think we only have Jim left. I think that's it, yeah. Okay.
Hey.
Jim has good stuff for us, and we are ending with Jim because for a reason. So,
I have the honor and pleasure of winding up the director's updates with the good news stories.
Yay.
For the month. So, first we'll start internally. We have the employee of the month this month in environmental health services. Her name is Jackie Johnson. And Jackie was nominated twice by two different people across the department. And I'll just read you the nomination because it's really good. I enthusiastically nominate Jackie for recognition of her outstanding contributions as a team player and leader within our organization. Jackie consistently demonstrates remarkable teamwork and cooperation in her everyday work, going above and beyond to support her colleagues and ensure the success of EHS team projects. Jackie embodies respect in all her interactions. She values the input of her colleagues and treats everyone with kindness and consideration. I'll vouch for that. Recently, before her well-deserved vacation, Jackie took the initiative to equip her team with a detailed email listing all the items she was working on, setting everyone up for success while she's gone. She provided organized content, contacts, and references to email folders containing extensive work she had done behind the scenes. This proactive approach set her team up for success in her absence, showcasing her exceptional dedication and foresight. Another recent instance that highlights Jackie's exemplary leadership was her investigation of a potential rabies exposure involving an elementary school. In collaboration with the public affairs team, Jackie communicated and provided a rabies exposure letter that was shared with over 900 families. Thanks to her poise, professionalism, and established relationships, she proficiently educated the school administration and nursing team ahead of the notification. This demonstrates her ability to manage high-pressure situations with grace and build bridges within the community. Jackie's continuously looking for innovative ways to improve workflows and support her team. Her commitment to setting her team up for success and her ability to facilitate efficient and effective workflows has significantly contributed to our organization's ability to protect public health. Her proactive approach and foresight are clear indicators of her innovative growth mindset. We're learning some things.
yeah.
Jackie's collaborative spirit is evident in her everyday work. She works seamlessly with her colleagues, always ready to lend a hand and share her knowledge. Her collaboration with community partners, local and state health officials, and public affairs during the rabies exposure investigations highlights her ability to work effectively with different teams to achieve common goals. Jackie is committed to ensuring equity internally and externally. She treats everyone with fairness and strives to create an inclusive environment where all team members feel valued and supported. Her actions inspire and empower her colleagues to excel, fostering a culture of equity and inclusion. I firmly believe that Jackie's dedication, initiative, and exceptional leadership make her an exemplary candidate for recognition she truly deserves. The second nomination was almost as good, but it was a little shorter. I'm excited to recommend Jackie Johnson for Employee of the Month. Her exceptional contributions to both zoonosis, retail food program, and epidemiology programs have been crucial to JCPH's success. Recently, Jackie's dedication was further demonstrated when she stepped up to help address a challenging rabies situation which caught national attention. She provided invaluable support and assistance under intense pressure, reflecting her resilience and dedication to environmental public health. She exemplifies JCPH's guiding principles through her respectful and empathetic interactions, commitment to fairness and equity, and collaborative spirit. Her unwavering dedication and cheerful presence in our office have significantly enhanced our work environment and community efforts. And I want to really emphasize that Jackie demonstrates all of this every day that she comes into the office, and she's only been with us for about a year, I think. So she's clearly joined the team and made a major impact. So that's Jackie. The other honor that I would like to share with you is external to the organization, and Mindy Rameg, who is my retail food program coordinator in environmental health services, was recently honored with the Colorado Environmental Health Association's Milton and Miller Award. And this is the biggest award that CEHA gives to its membership. This is their highest honor and is presented to outstanding environmental health professionals in a management position. And so this is a really big deal. And Jeffco has had a couple of these awards over the years. So we're lucky to have the award-winning leader on our team. Just, rather than reading all this, I'll share it with you all, but I just want you to know that Mindy has been around in the field and around in Jefferson County for going on 4 decades. And she has been the president of the Environmental Health Association. She's been the president of the Food Program Managers Group here in Colorado. She's played a major role in many environmental health efforts. She was our database guru forever in environmental health. She just has made a major contribution both to Jefferson County Public Health and to the state of Colorado. So we're really proud of having Mindy on board with us and that she's won this award this year. So I kind of get a little choked up when I read this, because she got over 20 letters of support from around the state and from various people in various roles around, not just environmental health professionals, but people who she worked with in planning and zoning and at the state health department, and various managers from all over the state of Colorado. So widely respected, widely deserved.
Awesome.
Thank you.
Thanks, Jim.
Very cool.
Yay. Very nice. Two additions is that we do have an honor roll this month for honorable mentions for Employee of the Month. So we had 3. We have Maggie Early, who's in Points West. We had Dana von Schomburg, who is our immunizations lead. So those are both in the clinic. And then Georgia Archuleta, who's right there in the back, is one of our honorable mentions. A pizza party, and it will be a lot of office level fun. So I also wanted to say that they ran out of awards to give Jim Rada from the Colorado Environmental Health Association, and he received a presidential citation because he too received a lot of glowing letters of recommendation this year, and we're not sure where that citation comes from, but so we have said that Jim has basically been knighted So we are so lucky to have Mindy and so lucky to have Jim and all this wealth of expertise in the department. I just feel really blessed. So thank you, Jim, and to your team, thank you as well. And I think that's it from the team.
Awesome. Staff comments, any staff online or here? Board of Health comments, board members.
Well, I want to
have a
say,
question. Sorry. Do we now have to call Jim sir?
Yeah, he's made us do that at the office.
It comes with gray hair.
Yeah. Great question.
so I just want to say congratulations to Jim because we heard that after we clapped. So I want to clap again.
Other board comments?
As always, I'm just thrilled with the work. I'm impressed every time I leave. So thank you to everyone.
I'm super excited about our band. I just wanted to say that.
Yeah, me too.
Yeah, I'm super excited. I love the idea of vaccines and voting and all this good stuff and just
Yeah.
exciting. So yeah, great ideas.
I'll share that the board had a retreat last week, and I think it was very good for us to engage and appreciate staff for joining for the afternoon. We've closed the feedback component for Dr. Story, but appreciate those who took the time to do that. That's something that we always want to hear from staff. So if you did miss that, you can still send stuff to me directly if you prefer. But we will be setting time to do our formal evaluation for Dr. Story, but appreciate those who've taken time to do that. Yeah, I'm looking forward to more outreach events. I was even thinking I should reach out to you to come to one of your events to get my shots. But maybe I'll just cancel my other one and come to it. But congratulations to Mindy. I've been fortunate to work with Mindy for most of my career. And she's one of those people that you're fortunate to get to work with. So Jefferson County having her for her almost entire career is just a treat that the community probably isn't there. So yeah, a gem for sure. So, and Jim didn't mention his own name as one of those award winners, but Jim has won that award. So we're in very good hands in Jefferson County with environmental staff. So. Any other, one other thing, I guess I'll just plant a seed. We don't need to generate it now, but if you have specific items, a couple things had popped up while we were talking, but for future either study sessions or agenda items, please get those to me so I can work with Lindsay to build out our agenda. I think updates at some point with the OWTS process and regs, because I know that's been the state's process has kind of put us on delay for a lot of things we had talked about, but that would be a good one to get somewhere into the forecast. But yeah, if there's nothing else.
Hey, sorry, just real quick.
Oh, too late. Go ahead.
Am I too late?
No, go.
Sorry, the gavel's so small, I can barely see what's happening.
He just hadn't learned how to gavel it yet.
I wanted to echo what Lane said. I've worked with Mindy before as well, and such an honor. Like I'm truthfully not surprised, and also feel like it's great to have Mindy on staff. And for Sir Jim, thank you for your service, and I'm sure that also well deserved. And thank you. I also I just returned from a conference where I got to share a room with a Jefferson County public health staff member, and it was just great to have Jefferson County represented in lots of really wonderful conversations around how we're looking and approaching and understanding community-based work that is exploring the public health approach to gun violence prevention. So just wanted to say, just great to share a room with some folks from Jefferson County and some really hard conversations.
Thanks, Sarah. All right, one last call. We're not getting it. All right, Meeting adjourned.